Hello guys, we'll be discussing about the topic of arterial blood gas which will be requiring very much in our emergency situations and IV care patients etc. So myself Dr. Amithis Kumar from the Department of Internal Medicine. We'll start with the definition of arterial blood gas. ABG is just a blood test where you'll be collecting the sample from an artery and you'll be measuring the levels of oxygen and carbon dioxide in our body. Along with that, you will be also testing the balance of acids and bases that is known as the pH balance. So O2 levels, CO2 levels, and the pH balance in our blood. After taking the blood sample, we will put the blood inside an ABG interpreter, and what we get is an interpretation of the oxygen levels, the respiratory and metabolic derangements, the acid-base balance, the assessment of carboxyhemoglobin, if in any way the patient has a carbon monoxide poisoning, and assessment of lactate levels. The procedure of taking an ABG blood sample, the ideal artery that we'll be using is the lateral artery since it is very peripherally located and also they have a good collateral circulation. The other arteries that we can use are the brachial arteries and the femoral arteries. We'll place the hand in an extended position and we'll be using the syringe as we are using a dart. We'll put the skin at an angle of 45 degrees and also 1 centimeter away from the index finger, the same finger that is used for locating the pulse. Before using the syringe, we need to pre-heparinize it with 2 ml of heparin. And overall, before even doing the ABG sample, we should be doing an Allen's test to make sure the collateral circulation is working or not. If the patient is on oxygenation, if you're starting, changing, or discontinuing O2 therapy, we need to wait at least for 20 minutes before drawing an ABG blood sample. Normal time requirement of taking the sample and making an analysis. So time required between collection of sample level and putting it in the ABG analyzer is 5 minutes in the room air. We need to be very fast. If it is a low temperature setup or in a chilled setting, 1 hour is the maximum time that you can take. If any delays goes beyond this timing, then O2 dissociates away and PCO2 builds up very fast. Contraindications. So there are actually some conditions we can't take the ABG blood sample, which is like if there's a local infection, thrombus formation, abnormal anatomy, abnormal Allen's test, that means the coronary circulation is not working, peripheral occlusive arterial disease, active Raynaud's syndrome at injection site, and a related contraindication like INR more than 3 and platelet less than 50,000. Is the normal pH in our body. The normal pH in our body comes in the range between 7.35 to 7.45, where our body organs and tissue functions will go in a perfect manner. What happens if the pH increases or decreases? That means if the pH has an imbalance, what can happen? See, our body is in a very homeostatic condition and is in dynamic equilibrium, so they try to bring it back initially by chemical buffers, then by a lateral adjustment, and finally by alteration in the acid secretion by kidney, which is the most and powerful. Starting with basic definition, what are acids? Acids are substances that have at least one H plus ion and can donate one H plus ion in the solution. Base is something that can accept a H plus ion. The most acids and bases in our bodies are is very weak and is present in the ECF. Two classes of acids include volatile acids, also known as carbonic acid, H2CO3, and fixed acids, also known as non-carbonic acid. See, the volatile acids are actually produced by the metabolism of carbs and fat and is generated in a very vast amount. And the fixed acids are actually produced by the metabolism of proteins. Since these acids and bases are formed inside our body, how they are excreted outside? The most important organ that take part here is the lungs and the kidney. See, the volatile acid, as the name suggests, being very volatile, is excreted out by the lungs. If it is a fixed acid or non-volatile acid, it is excreted by the kidney. See, the carbonic acid H2CO3 doesn't always stay as H2CO3. They dissociate to form CO2 plus H2O and also H plus bicarbonate. CO2 being very volatile is eliminated by the lungs and bicarbonates is eliminated by the kidney. The points to remember, just as I told you, the volatile acids are formed in a very vast amount. So lungs is a plays a profound role in acid-base balance. So the homeostatic response in our body includes first by the chemical buffers, which is the bicarbonate system, phosphate system, and the proteins in our body. Secondly, by the pulmonary ventilation, that means there will be alternating rate and depth of ventilation and by altering the PCO2 levels, which begins at 1 hour and fully established by 24 hours. Lastly, by renal control of acid-base excretion, we'll be having H plus excretion, bicarbonates excretion and or reabsorption, which typically begins by first day and fully established by 3 to 5 days. Definitions, go with definitions. What are the common metabolic disorders? Before that, you need to remember just one thing: CO2 is an acid excreted by the lungs, and bicarbonates are excreted by the kidneys. These are the definitions you need to know. What is acidemia? State of low plasma pH. Acidosis is a disorder that predisposes to low system pH. Alkalemia is a state of high plasma pH. Ankylosing, as you know, you can predict, it's a disorder that predisposes to high systemic pH. Metabolic acidosis, the term, like the term, it is like the patient has a disorder that predisposes to low pH levels and by a low serum bicarbonate concentration. Metabolic acidosis, high pH, high serum bicarbonate concentration. Respiratory acidosis, low pH and high PCO2. Respiratory acidosis, high pH and low PCO2. How we can remember this is you just need to remember that in respiratory syndromes, pH and PCO2 are in the opposite direction. In metabolic syndromes, pH and PCO2 are in the equal direction or the same direction. We just have to remove the mnemonic ROMS. Respiratory is opposite and metabolic is in the same direction.